Welcome to Passive Curiosity in an AI world where we explore tomorrow's careers through the lens of AI. How would you feel if a company was using your health data to make money? Dr. Erin Holve helped write the laws meant to protect you. Let's get curious. Today, we're continuing our AI in Healthcare mini-series, and I'm excited to be joined by Dr. Erin Holve. Dr. Holve is a health services researcher and methodologist, and one of the people behind the data systems that make AI in healthcare possible. Over the past 2 decades, she's worked across government, research, and policy to turn health data into evidence that actually improves care. She's also helped create how people talk about AI and data in health policy, creating shared language and standards so patients, clinicians, and technologists can understand one another and make decisions together. Dr. Holve, thank you so much for being here.
Hi, Katia. I'm pleased to join you. And as your aunt, it's especially fun to hear the kinds of questions that you're raising for your listeners about a topic that I care a lot about, which is healthcare systems and how data and artificial intelligence are changing the future and possible career pathways.
So, then to start off, if your teenage self followed you around for a week, what would they see you doing and what would surprise them the most about your job?
Well, there is no doubt that I am really fortunate to enjoy my work. And so I think that is something that my teenage self would really be happy to see, right? Wouldn't you be happy to see yourself in the future really enjoying the work that you're doing and also to see how much it's changed and continued to grow and develop? So I think that's kind of the first thing, right? That your listeners should know is that when you look back, that's one of the things you really want to try to do in your career is continue to follow the things that interest you. I have a lot of fantastic and smart colleagues who I work with. I have a lot of variation in my week. I get to think about technical questions. I get to think about personnel issues. And so I really like thinking about those kind of big, messy questions. I know we'll talk a lot more about that in just a bit. Maybe with respect to the topic of this podcast, one of the things that I think my teenage self would perhaps be interested to know is that artificial intelligence right now has not changed most of my day to day work. Because again, the fundamentals, particularly as a researcher, related to asking good questions and making sure there's high quality data and a lot of rigor and quality control in the work that I do, those are all things that stay the same no matter what tools you're using. And artificial intelligence, and particularly large language models, are just the latest set of tools that we use.
That's a great point to note. For students who've never heard the term health services research, how would you explain what it is and how it affects healthcare?
Yeah, so health services research is exactly what it sounds like. It's thinking about all of the big, messy questions that happen within the healthcare system. So it's really, the range of challenges, problems, and opportunities to make healthcare better for people and communities. And so health services research covers, it's what's called a multidisciplinary field of inquiry. And so it includes biostatistics, biology, epidemiology, which is really the science of public health, economics, system thinking overall. And so it's just a really dynamic field that has a lot of potential to work, as you said, about my background and a lot of different parts of different sectors, different parts of the economy, and to try to answer some of these complicated questions. Everything from how do different conditions or outbreaks, like a measles outbreak, affect communities, and how can we try to keep people safer, to health insurance, how can we make sure that people are receiving care that they need, to how does an individual make particular treatment decisions, right? If you just got diagnosed with type 2 diabetes, for example, what are the best treatment options for you? And what do your family members, what do your other caregivers need to know to help you have the healthiest lifestyle possible?
I know you mentioned that AI hasn't really changed your research career much, but are there specific ways that AI is showing up in your daily job?
Certainly. So, in a couple of ways, artificial intelligence is obviously a very powerful tool and methodology that can be used to try to address certain issues that we face in research, right? So, a really good example is thinking about how you manage data. There's a lot of laborious tasks that researchers have to do to make sure that data is clean and it's accurate. And so, there's a lot of interest and try to see if AI can be used for those types of activities. So, one good example might be making sure that health information on a particular patient or research participant is actually linked across different healthcare systems or settings where they might be receiving care. Or if somebody is doing a research project on family conditions or factors within family life, and they want to actually be able to link information across family members, right? There's some promising strategies that perhaps artificial intelligence can use in that regard. There are also some analytic and statistical ways that artificial intelligence can potentially be used. And so it's great to see all of these different kind of strategies being used. One of the key things is to really make sure, however, that they're appropriately tested and what's called validated to make sure that they can be used for all of those purposes.
So, as AI plays a bigger role in careers today, how do you see the balance between human judgment and AI in research and policy jobs?
It's such a great question because AI is fundamentally a tool, right? It's a new technical tool that we have to, again, address questions. It can help with data cleaning. It can help with formatting. It can help with making sure that we can translate information from research so that it makes sense to the key populations who might be interested in understanding the findings from that research. So that's all fantastic, right? But one of the things that's really important in research and policy jobs is that often researchers are thinking at the level of hundreds of people, thousands of people, hundreds of thousands of people, even millions of people, right? Especially to make policy decisions. So I and my colleagues take those kinds of challenges and questions very, very seriously. And what that means is that back to your question, human judgment is absolutely critical when you're making decisions that are potentially going to impact the lives of millions of people. It's really important to make sure that you're actually talking to people, right? Finding out what it is that individuals, their families, their communities really care about, and making sure you're asking the questions from a research perspective that matter to them, or developing policy solutions and changes that are actually going to make their lives better.
You've also worked a lot on learning health systems. What does that mean? And do you see AI helping close the gaps between research and real world care?
So, the idea of a learning health system is that every encounter, interaction you, for example, or other members of your family have within the healthcare system should be contributing information that can then be combined with other experiences that you've had in your life or other experiences that people like you have had to actually figure out what is the best way to treat people like you? What is the best way to provide healthcare services for people like you, right? So, it's that idea that every encounter, all of the data that we now have access to about the healthcare system, perhaps through resources like the electronic health record, which some of your listeners may know about. It's the idea that all of the information in your healthcare encounter is now encoded in computer systems and digital systems that actually can be used and potentially, again, combined with data from other people to learn more about what's actually working at a population level. That's a very powerful idea, right? Because it means you get to bring the experience again of tens of thousands, millions of people together potentially to make the health system better. The challenge, though, that we've seen now over the last 20 years since we've been moving in this pathway towards digitizing data and making it more useful for this kind of learning is that there's a lot of private or commercial interests in that data, right? Now, there's an important set of regulations that I was involved in helping to write in the early 2000s called the Health Insurance Portability and Accountability Act, which has now been updated a couple times, that is designed to make sure that folks understand that actually your health information, Acadia Holve's health information, is your health information, right? And as you go to see doctors, as you're part of health systems, they are responsible for protecting that information, but that fundamentally it's yours. That's a great idea. Again, it's been around for about 25 years, but the challenge continues to be that sometimes organizations feel like, oh, we got to really protect that information. And we don't necessarily really want to share it, right? Because we have some business interest in holding on to that information. And so, unfortunately, it isn't as easy to achieve that goal of a learning health system. So, one of the things that I think is going to be really important over the next several years as we see more development and deployment of AI tools in health systems is how much the public and how much providers and how much these systems and companies are committed to making sure that all of the data and tools that have been developed can be used in more of an open way. Sometimes this is referred to as open science, so that you can actually use all that information and all of that analytic power to be more of a learning health system. So that's something that I think we all have an interest in assessing and making sure happens.
So it sounds like it's at the base of responsibility and trust.
Absolutely. And actually, maybe I'll ask you a question. When you think about your health information as you go to the doctor and you talk to them, what expectations do you have for making sure that information is being used to benefit you or your family members, right? As opposed to necessarily being just technology that makes a company more money.
It is a great question for all of us to understand and try to find that balance between
Exactly.
helping others and protecting ourselves.
Right. And then the other question, of course, is we live in a capitalist society. We want to see incentives for new tools to grow and be built and innovation, right? No question about that. But at the same time, if a company is using your information to make a lot of money, how do you feel about that? So that's
Yeah.
part of even what going back to 2000 and HIPAA or the privacy rule, that was a lot of what that activity was about, was trying to say there should be a balance and the public should have a right to protections and to use of their information. There's an interesting wrinkle there that again relates to this learning health system, which is that while there are certain what are called covered entities, health systems, doctors, et cetera, who are required to adhere to that privacy rule, when an individual uploads a lot of their personal health information to a commercial product like a large language model or a chatbot, some of that information is not necessarily protected by HIPAA, right? Because you have decided to put your own information into a commercial product. And so that's actually something that a lot of policymakers are trying to take a look at and address at the very least, right? So that individuals understand that's the trade off that they're making.
So maybe to now help our students a little more, beyond technical skills, what human skills do you think will matter the most in health research and policy by 2035?
So I know I'm going to sound kind of old school, but it really goes back to fundamentals, right? Research has been around for a long time. We have good, strong scientific and ethical principles to guide research. So I'm going to pick up on three that I think are going to continue to be really important for people. The first is read a lot. Be a critical thinker. There's just no substitute for reading. I know you've joked about the fact that I'm a big reader, right? You see those books that I bring with me everywhere, digital books, right? And so, if you read primary sources, if you are really engaged in what you're hearing and learning about, it's a lot easier to discern or understand some of the things that might come out of an AI summary, right? I think the second thing is asking good questions. All research, all policy is about paying attention to what's happening in your own life, to those who are around you, and asking yourself, why are things this way? What might be making some people in my community more or less healthy? than others? What might I learn, right? Let me ask my friends, my neighbors questions about what their experience of their kind of health behaviors is, or whether they have access to healthy food, or if they're taking some of these weight loss medication and anti-obesity medications and the experience they're having. And how could that be better? How could we make some of those resources more accessible, right? So just continuing to ask good questions. Another example is you go to the doctor probably every year and you get an assessment of height and weight, and they, do some other kind of measurements, right? Well, why do doctors take those particular measurements, right? What do they tell you as even a teenager about how you're growing or whether or not you're making healthy choices? Some places also have questionnaires. What's your use of screen time, right? How are you feeling? Are you feeling isolated? So, all of those interactions, for example, with the healthcare system, are an opportunity for young people to be thinking and asking questions, right? So, ask those questions. And then the third thing is to then think, again, as the subject of this podcast, could AI help me with that inquiry? Could AI help me come up with an innovative solution once you've understood some more of these issues that might innovate and help improve healthy behavior or healthy outcomes for folks in your community? All of those kinds of things are very health services researchy questions that I think will absolutely continue to be important. And maybe I'll add a quick fourth, which is, how is it going to benefit your community? I think as long as people keep thinking in those ways, there's an opportunity to really be a great contributor, no matter what you choose to do in your career.
So, reading, asking good questions, using AI responsibly, and seeing what you can do to help in your community. Got it.
Absolutely.
So, are those the things that you would suggest people do as concrete actions they could take this year to start exploring your career as a path?
Yeah, absolutely. I think there are, again, as I mentioned, you don't have to be in graduate school. You don't have to be working in AI to start thinking about how to ask good questions or consider things like, how could my school promote healthy behavior? How could my neighborhood promote health? How could my interactions and resources that I use online be more healthy? Everything in research comes back to asking good questions. And then you've done some primary research, right? Then the next step is really figuring out how to make sure that there's really good rigor and transparency, or sort of clarity in the way that you collect your data and then analyze the information. And I think that's just, again, to go back to the promise, but also some of the pitfalls with AI. That's really one of the things that we have to do now, that I'm seeing certainly in my career, is we have to do a lot more testing of some of those algorithms and resources. And it's one of the reasons that I'm a big fan of using more open source models, where you can really assess the weights and some of the training data sets that are used. Some of your other guests may have talked about the Hugging Face website, which is where you can go to see a lot of different large language models, and people are sharing all the code and information so that models can be adapted and developed. So, encourage your listeners to start by asking these questions and then critically evaluating the degree to which some of the models that are out there might be helpful for addressing those questions and issues.
How did you realize that your bridge role between data, clinicians, policymakers, and patients was a good fit?
So I think it probably started in high school, which is really appropriate, again, for your listeners to think about. I always was really interested in big, messy questions. And so I would encourage any of your listeners who find themselves drawn to big, messy questions, things that are not going to get solved in a day, that are not easy, to take heart, right? So I started in high school thinking more about environmental science and environmental issues, which actually has a really good pathway and transition to public health. So I think at that time, what I realized was that often, and you probably see this in your own life too, right? People just don't communicate very clearly with one another. They use jargon, they use different kinds of information. More technical people can't really talk to less technical people. So different ranges of technical issues. And sometimes what people think they really need to address their health and address those issues, people just talk past one another. So I think that's what I really realized early on, was that I was a good kind of translator. I think you just know if you have that desire to help people really improve overall their communication and the use of science to make things better. And if that's something that you or your listeners find interesting, then I would just encourage you to stay the course and continue trying to be that person who talks to a lot of different individuals or communities and gets feedback to really try to address real problems. Because it can be, as I said at the start of our conversation, it can be a really, really valuable and rewarding career pathway.
So, maybe going off on a slight tangent, you've helped shape how people describe AI and data in healthcare. Can you share a time when the way we talk about AI or data changed real world decisions?
Yeah, so I have a couple of examples that might be relevant. But what I'm going to do is I'm going to go back a little bit in time, because I think we can learn a lot, like you said, from thinking generally about some other things that have happened with data and then how they might be applied to artificial intelligence or the use of large language models. So back in 2009, there were two big pieces of legislation that were passed. One, some of your other guests may have talked about the High Tech Act, which was really the big funding from government to help doctors around the country move from taking healthcare information on their patients in paper and storing it in paper to making sure that it was electronic. That's a really critical stepping stone for what we're experiencing now with AI, because if you don't have the information digital, if it's all on paper, very difficult to do the kind of analysis that we're talking about with AI. And concurrent with that, there was also a lot of funding for research to say this learning health system idea, right? How are we going to use all this information? And at that time, as I mentioned to you when we were talking about the privacy rule, there wasn't really this concept of patient rights or what patient centeredness actually might mean in the healthcare system. There was much more of a sense that, well, my doctor tells me what to do and I just do it. And so that was a really critical juncture where some of the documents that we developed, particularly I was involved in developing the first notice of privacy practices, which was really a statement that now doctors' offices had to give to patients that said to them, this is your information. You have a right to it. You have a right to request it. You have a right to understand it, all those kinds of things. And so establishing that kind of right that individuals had really changed some of the conversation about how people were using data and their information. And that conversation continues to this day. People are still trying to figure out how to make the best use, for example, of ChatGPT, or recently ChatGPT Health was released, right? As well as some of the other tools that have come out from others like Anthropic and so forth, so that people can actually feel like they're more empowered to aggregate a lot of their own health information, because it's still the case that we have a lot of different electronic health record vendors that different doctors use, right? And so for a patient to pull all of their information together can still be a little tricky. So again, that sort of patient centeredness, that notion of patient rights to your own information is definitely something that I've been involved in. And then more on the research side, I'll just note that when a lot of this digital information was starting to emerge, one of the key things that, again, was also due to the fact that there were a lot of these different electronic health record companies who stored and organized data in different ways, was that when researchers were pulling all of the data together to do research, they were all doing it different. So I was part of a project at that point that was seeing how all of these different research groups from the top institutions across the country were all thinking about things like how to identify where there was a problem with missing data, whether there were records that had height or weight information that didn't make any sense, right? And again, all doing it differently. And so the notion of how to actually create more methodologies for data quality was something that I would say for a couple years, people said, oh, we don't need to do that, right? Like, why would we need to do that? But as it turns out, if you want to have more of a learning health system, if you actually want to have more of a consistent and solid and reliable approach to analyzing data for research, you got to have good data quality. So I was involved in several projects to really try to define and characterize both what was meant by data quality of EHR data or digital healthcare data, and then how to actually measure those concepts.
So now to zoom out, in the next 2, 5, or 10 years, where do you see AI changing healthcare the most?
Well, I think AI is just going to be ubiquitous. Again, for most of our conversation, I'm really thinking about the use of large language models, right? So the ability to really analyze text. I mean, some of it's the analytic tools, but I think that's really where we'll see the biggest integration. So we know and you can see there's already places where chatbots and sort of text analysis is helping people evaluate questions. One place that I really hope we'll see the use of these large language models in a patient centered way, though, again, I think there's more need for testing, is the idea of how they can help translate or improve health communication for a variety of different individuals. So, I have some colleagues who recently wrote a fun paper that was focused on ways to make research or healthcare in general more connected and kind, careful, kind, and connected. Those are all things I think we can agree are important in healthcare and in health research, right? And one of their aspirations is that artificial intelligence tools, and again, especially large language models, are really used to do things like you're interested in chess, for example, right? To say, if you asked a chatbot, please explain the following research study design, or please explain the treatment option my doctor's suggesting to me in terms that somebody who loves chess would understand. And so that kind of individualized, tailored communication is something that, again, my colleagues are really interested in. So I think that's something that will happen in the next couple of years. I think longer term, again, as I mentioned, I use the word ubiquitous, which is it'll just be everywhere, right? We won't even necessarily see it or know where AI is being used. And I think that's something that hopefully your listeners, your audience, again, will link back to my comment about being a critical thinker, because my hope is that there will be some transparency for consumers about where AI is being used so that you can decide, do I want to use those tools or do I not want to use those tools?
Those are some great points. And before we wrap up, is there anything students exploring AI, healthcare, or policy should hear that we haven't covered?
So I think there are two concepts that I just want to make sure to introduce because I think they're super, super important. So one is the idea of socio-technical systems. I know that's a really big sounding word, right? But the idea is essentially that I think I've talked about very nicely on your podcast that technology doesn't exist in a vacuum. Technology is very much what we do with it. And so the idea of a socio-technical system is encouraging people at all levels to think about how technology and those tools are interacting with society and to think at that individual level, community level, state level in the US's case, right? Like really to think critically about how technology is influencing your lives and the lives of people you care about at all these levels. And we talked about answering those questions. So I've got a prop or a suggestion for extra credit for any one of your listeners who's interested. So this is a fantastic book, Power and Progress. Do you see how thick it is? So this was my summer reading. This is my beach reading a couple years ago. But these guys just won the Nobel Prize last year. And this book really talks about a variety of different technologies that have been introduced over time and how what society did with them determined whether or not they were contributing to improving the quality of life and human experience, or whether they were not. And so they make a lot of parallels and discuss artificial intelligence a lot in this book. The other one that I think is especially, and again, for your listeners who are really doing the extra credit, the other concept that I think is important to introduce for particularly for your generation is the concept of blockchain technology. And so most people think about, have any of your other guests talked with you about blockchain
No.
technology? Blockchain technology is generally the mathematical background that underlies cryptocurrency. So most people think about it in that way, but it can be used as a building block for lots of other kind of identity management. And the key thing that I think will be useful for your generation to think about is there's a lot of discussion right now about the way that corporations, organizations can suck up a lot of data, a lot of creative content, a lot of new ideas that are emerging from smaller content creators, and that they can do that without having to necessarily pay them for that intellectual property. So, this is a really interesting book. It's called Read, Write, Own. And the idea is basically that there are strategies, there are very productive strategies that can be used to make sure that individual creators can preserve the right to support and build their own ideas and continue to contribute to the public in whatever way they choose, either commercially or for the public good. And that's related, I think, to the third thing, which we talked about a little bit, but is an important idea to come back to, which is the idea of open source. And it's the question for your listeners as they think about their careers, about how much of their work they want to be available and open to the public, and how much we want to preserve the idea that particularly science should be open and free to promote the exchange of more ideas and develop and improve for the public good, right? And so I think all of those ideas together are really, again, very important socio-technical considerations, because how you and your friends and community decide to build your careers using artificial intelligence or not is really what will build the future. And that's exciting. And it's also important to really think about.
All right, listeners, don't forget your extra credit reading. Well, Aunt Erin, thank you so much for sharing your time and perspectives today and helping us understand how AI is changing not just healthcare, but data, evidence, and the policies behind it.
My pleasure, Acadia.
And for everyone listening, remember, the goal isn't to predict one perfect job. It's to build skills and curiosity that can grow as AI and careers continue to evolve. If today's conversation sparked your interest, explore our other episodes in our AI in Healthcare mini series. Check out our AI in Healthcare Future Jobs Map and resources linked in the show notes to learn more. This has been Paths of Curiosity in an AI World, where we explore tomorrow's careers through the lens of AI. Until then, stay curious.